Choosing Wisely is a collaboration between specialty societies, Consumer Reports, and ABIM Foundation to identify 5 things that have more risk than benefits. And it's to begin a conversation between patients and physicians about the issue of overuse and about choosing wisely, and providing the supports to both patients and physicians about how to have these conversations. The origins of this idea came from 2 sources. One was an article by Tom Brody in the New England Journal of Medicine calling upon the specialty societies to develop 5 things that were wasteful. And it also came from an experiment, a small grant from the National Physician Alliance that applied it to pediatrics, internal medicine, and family medicine. We set out 4 general parameters. We really wanted to empower the specialty societies to use their own processes and their own committees to come up with the 5 things they should not be doing. At least having questions for physicians and patients to talk about. No absolutes. The 4 things were: must be evidence-based, must be frequent, must be transparent, and within the control of the specialty society. We have gotten tremendous positive responses to all quarters, physicians and from patient quarters. And I think what's really ignited everybody is this conversation with no absolutes, but an informed conversation about what's right for that particular patient within those clinical circumstances. Right now, there are 60 specialty societies recommending over 300 recommendations. So this campaign has gotten some kind of snowball effect that's really beyond us. Every integrated delivery system that's interested in looking at volume, away from volume, and to quality and to value is looking at choosing wisely. And I would say to the hospitals that this is an incredible opportunity for them to use the cover and the legitimacy from the specialty societies and the Consumer Reports translations to really think about how to remove these tests and procedures that don't add value. And this is a real opportunity, I think, for the hospitals, the health systems, to take things that are really been sanctioned by somebody else, and they can point to them as they move down the road. It can be not just a technical solution, but a very adoptive value alignment that can go on. So this campaign, I think, has proven that the right messenger, the right message at the right time can really have a huge impact on harm, on waste, on quality, and ultimately on affordability. We look at what we've done. We have 60 specialty societies, over 300 recommendations. In the first 3 weeks of the campaign, we had over 300 million impressions. We've had over 150 clinical articles done. This campaign has now gone international. There will be a Choosing Wisely Canada, the Netherlands will have a campaign, New Zealand, Australia, Germany, UK. We really think that this kind of proves the value of the conversation and proves what we want, what we really were out to achieve. And that was a conversation between patients and consumers, and to change the tone of the dialogue away from rationing, away from killing grandma, into really a thoughtful conversation about appropriate use in healthcare.